Okay, hello guys. Today I'll be talking on a supplement, omega 3 versus omega 369. So I know some of you will be curious to know what's the difference between these two supplements, and also when can I recommend or use any of these supplements. But before I start, I want to first of all talk about a condition that this supplement handles, and that's inflammation. When you mention inflammation, what comes to mind is swelling. You get, and inflammation have like a very good side, because it's like the body's protective mechanism to stress. Whenever there is cut, there's stress, there's injury, what the body first um what the body would naturally do is inflammation. So when it happens for a short time, when it is acute, it is actually good. During your healing process, during a cut, during wounds and all that, inflammation comes in, the healing is actually taking place. But then when this inflammation takes place for a long time, when it becomes chronic, that is when it is bad. So we want to look at the different inflammatory conditions we have. We have a lot of inflammatory conditions. Do you understand? Yes. But then I would also want to look at a few, like 4 to 5. Now, when there's inflammation in the brain cells are inflamed, it can lead to memory loss, it can lead to a decline in cognitive function, it can even lead to Alzheimer. So also when there is inflammation in the joints, that's when I talk about joint pain, joint swelling, you see rheumatoid arthritis. Then we also look at asthma. Asthma, there is inflammation of the airways. The airways are inflamed, right? Making breathing difficult. So the person begins to gasp for air, wheezing sound, cough, and all that. Also, we also have heart diseases. When the arteries, the blood vessels are inflamed, inflammation damages the blood vessels. You get it. It can also bring about build-up of plaques, build-up of substances in the blood vessels. Hence, blood cannot easily flow through the blood vessels. Hence, bringing about increase in pressure, which can lead to hypertension, increasing the risk of heart diseases and cardiovascular diseases. Okay, now let's dive into the supplements. Omega 3 versus omega 369. What's the difference, and when can either of them be recommended? Okay, now omega 3. Omega 3 is made up of 3 fatty acids. Alpha linolenic acid, which can be gotten from plant sources like flaxseed. Then we have the icosapent pentanoic acid and the docosahexaenoic acid. This can be gotten from fish, normal fish we eat in our diet. Yes. And then what's the primary benefits of omega 3? Omega 3 has anti-inflammatory properties. So for those of us handling inflammatory conditions, chronic conditions, you can add this as an adjoint supplement to the medications you're on. So it has a way of reducing inflammation. Hence, it helps to support healthy heart. It's actually good for the heart. And also, the DHA, the docosahexaenoic acid, is good for your brain health and even your eye health. Now, omega 369. Omega 369 is a mix of fats. It contains omega 3, omega 6, and omega 9. We've already discussed omega 3. Now, omega 6 is also called linolenic acid, and it can be gotten from vegetable oils and nuts, your walnuts, cashew nuts, and all that. Then what are the primary benefits of omega 6? It actually plays role in skin and hair health. It has a way of moisturizing the skin and preventing scaly and dry skin. It's omega 6 does the magic. Then then one thing about omega 6 is that then it also has role in hormonal imbalance. It helps to balance your hormone. We have the gamma linolenic acid, which is the omega 6 we find in evening primrose, which plays a role in balancing hormones. Then omega 6 should be used with caution. It should be used with caution. Why? Because it is pro-inflammatory. It has a way of triggering, it has a way of causing this inflammation we are trying to avoid. So there should be a balance. Then we have omega-9. Omega-9 is called oleic acid, and it can be found in olive oil. It's actually good in reducing triglycerides. It's good in reducing cholesterol, bad fats. For those persons having hyperlipidemia, you might need to incorporate this into your medication. So it should be in like balanced ratio. So balanced ratio is key amongst the three omegas, omega 3, 6, and 9. So when can I recommend? When can I use either of them? Which should I take? Yes. So if you know that your diet is high in, omega 6, like 65 to like 75% of your diet is with fried food, processed foods, vegetable oil, nuts, just stick to omega 3, because remember I said that when omega 6 is taken in excess, it is pro-inflammatory. It can cause inflammation, and that's what you're trying to avoid. Yes, so it's like counterproductive. You're taking omega 3 as anti-inflammatory, and you're taking something omega 6 that is pro-inflammatory, that can still trigger that inflammation. That's not what we want to do. So we would actually look at your diet. If your diet is high in fried, nuts, processed foods, we'll just stick to omega 3. But if your diet is moderate, then you can then take the omega 369. So I hope you get the gist, and you can clearly tell the difference between the omegas. So you can save this on your phone for reference purpose. You can share to someone managing chronic conditions. You can also share to someone confused about the omegas. I really hope this helps. Thank you.